Dear committee, dear audience, dear colleagues, it is a pleasure to be here today with all of you, and in the followings I would like to share with you my progress on my topic, which is about the management of cardiac arrhythmias and conduction disorders. My name is Bernadett Miriam Dobai. I am a cardiology resident doctor and PhD student, currently taking part in the bilateral program between the George Emil Palade University of Medicine, Pharmacy, Science and Technology of Târgu Mureș, Marosvásárhely, Romania, and the Semmelweis University. I came here to CTM with a clear vision, a world with less heart failure, and my mission is to reduce heart failure incidence through adequate pacing modalities. With my supervisors from both countries and with the research team from CTM, we are currently working on 2 projects. So my specific goals for the period ahead of me is, first of all, to find the best pacing modality for patients who require permanent pacing due to bradycardia, and second of all, to offer more insight into the incidence and pattern of atrial fibrillation after atrial flutter ablation. Both projects were started last year in the fall, and we are using systematic review and meta-analysis to assess these questions. So first of all, let me present you my first project, which is comparing the safety and effectiveness of pacing modalities in patients with bradycardia through a systematic review and meta-analysis. So why is this topic relevant? Because more than 500,000 pacemaker implantations take place in Europe, and this is a continuously increasing number. Patients with AV block or bradycardia require permanent pacing implantation. Although the right ventricular pacing has been the standard approach, this can lead to ventricular dyssynchrony and potentially causing or worsening heart failure. Over the time, to address this issue, alternative pacing modalities have emerged, such as biventricular pacing and conduction system pacing. However, the comparative effectiveness of these pacing modalities remain unclear. So the aim is to investigate the outcomes of different pacing modalities, conduction system, biventricular, right ventricular pacing in patients who require permanent pacing due to bradycardia. So the clinical question is, are these alternative pacing modalities more effective than the traditional, conventional, well-known right ventricular pacing? To address this question, we adopted the PICO question framework, meaning that we would like to compare conduction system pacing or biventricular pacing to right ventricular pacing in the population of patients who require pacing due to bradycardia on outcomes, first of all, on mortality, heart failure-related hospitalization, heart outcomes, but as well as on echocardiographical, ECG parameters, complication risk, success rates, and so on. The hypothesis is that conduction system pacing and biventricular pacing are superior to right ventricular pacing. If the hypothesis will be confirmed, that means that the results could be translated directly into clinical practice, supporting the safety and effectiveness of these pacing modalities in reducing heart failure-related morbidity and mortality. So during the feasibility check of this project, besides checking previous meta-analysis and original articles, we had to develop an optimal search key. A search key which is contains 2 domains. The first is referring to the population. The second one is referring to the intervention and comparator. This search key was approved by the research team and resulted in more than 10,000 articles. Following this, with the research team and with my supervisors, we were thinking about making subgroup analysis as well, and we were thinking about doing, besides doing a direct comparison between biventricular and right ventricular pacing, respectively conduction system pacing and right ventricular pacing, we were thinking about doing, if possible, an indirect comparison between these 2 newer pacing modalities through the methodology of a network meta-analysis, if possible. This way, we could rank these 3 pacing methods in between them and offer more insight to physicians in choosing the best pacing option for the profile of their patients. So regarding the first project's progress, the topic was feasible, Prospero was registered, duplicate removal was done, title extraction selection, full text selection as well, and we are currently in the data extraction phase. We are done with 80% of the articles with my selection pair together, and we are currently extracting these 10 key articles. We are focusing on mortality, heart failure-related hospitalization, but as well as on echocardiographical outcomes, ECG outcomes, clinical outcomes measured by NIHA classification, and 6-minute walk test. And also, we are interested in the operation times and fluoroscopy times. To offer my insight into the selection process, I would like to share with you that initially we had more than 12,000 articles, and after doing each phase of the selection process, we managed to narrow it down to 86 articles, and the deadline for data extraction completion is next Friday, and we are on track to achieve this with my selection pair. This leads me to my next topic, which is investigating the incidence of atrial fibrillation after atrial flutter ablation through a systematic review and meta-analysis. To put this in context, I would like to remind you that atrial flutter and fibrillation are closely related arrhythmias, and both are highly associated with the risk of stroke. While radiofrequency ablation is a highly effective treatment for atrial flutter, the risk of subsequent atrial fibrillation remains a pressing concern. This is critical for guiding anticoagulation strategies better to prevent stroke. However, data about atrial fibrillation incidence varies widely due to different methods and monitoring durations, and inaccurate estimates obviously lead to under or over treatment. So we aim to investigate the incidence and pattern of clinically confirmed atrial fibrillation following atrial flutter ablation. The clinical question is, what is the real incidence and pattern of atrial fibrillation following flutter ablation? To answer this question, we would like to adopt the COCO-PUP question framework, meaning that we are investigating the condition of atrial fibrillation incidence in the population of patients who underwent flutter ablation, by monitoring them with implantable loop recorders, holsters, or ECGs. The hypothesis is that AFib incidence is high in patients who underwent flutter ablation, and the clinical implication would be to guide anticoagulation strategies better and to reduce the risk of stroke. This project is currently in the feasibility check phase, and we are planning on progressing with this project in the following weeks. So to summarize, I would like to share with you that we are currently working on 2 projects. The first one is aiming to find the best pacing option for patients requiring pacing due to bradycardia, and the second one would like to offer more insight into the incidence and pattern of AFib after atrial flutter ablation. The planned submission date for both of the projects are until the end of this year. I would like to end my presentation with a quote from Ole Peterson, who was here at the last Nobel event, and he said that the key to success lies not only in dedication and hard work, but also in having a bit of luck and being in the right place at the right time. Thank you for your kind attention, and thank you to CTM for all the help, and for the supervisors as well. Thank you.
Thank you for the presentation. Questions? Just one short question for starting.
Please.
What do you think regarding your first project, these 3 modalities of pacing? Is there one which is superior to the others, or what I think that there are patients who benefit more from one pacing modality, there are other patients who benefit from the other, because I don't think so that we should pace everyone with biventricular pacing, yes, if you know what I mean.
That's right, that's right. Yes, so the standard approach, the standard recommendation for AV block or bradycardia, currently according to the guideline, is to do the RV pacing method, because that has the most of the evidence over the time. But as far as we know, that up to 20% of the patients who are receiving RV pacing could end up having heart failure or developing heart failure. So we would like to see which is the category of the patients who could benefit, not from the RVPs, but maybe from the conduction system pacing method, because that is very similar technique to the
This is the real question. Who are those who will benefit?
Yes, and we would like to answer this question with this meta-analysis, because we would like to do subgroup analysis based on the ejection fraction of the patients who are enrolled in the analysis.
Thank you.
Yes, thank you.
Yes, and I was wondering, I'm not that familiar with this field, whether this pacemaker device is available in Hungary currently.
Yes, they are available and reimbursed, but availability, of course, depends on the hospital and region as well. But for example, in Budapest, these devices can be implanted. For example, in the military hospital, they are doing on daily basis, and as well as in the Városmajor Clinic, they are doing the procedures.
Thank you for your presentation. My question regarding your second project, you are investigating the incidences of atrial fibrillation.
Yes.
And what's the incidence of atrial flutter after ablation of flutter? Does it happen, or in some cases I can see from my practice that cardiologists prefer atrial fibrillation after instead of atrial flutter, and what's the mechanism behind it?
So you are asking me about the recurrence rate of atrial flutter after the flutter ablation. Yes, so they are varying data about this, but basically the success rate of atrial flutter, according to the literature, is around 90%, and in 10-20% of the cases can reoccurrence appear afterwards. So it's not such a big percentage.
Okay, thank you.
Congratulations on your progress. I would like to ask
you.
What is your prediction? And if I can have a second question, I would like to ask you, what is your expectation? How many patients are you going to pull?
Yes, thank you for your question. According to the data we have right now, we extracted around 80% of the data. We expect to have around, in total for all outcomes, around 4,000 patients. But for example, for the hard outcomes, mortality and heart failure related hospitalization, we have less articles who report data on this kind of outcomes. So for those outcomes, we will have less patients.
Thank you.
Thank you.
So congratulations.
Thank you.
Your presentation was very well structured and straightforward. I have a methodology question. Regarding your first project, is right ventricular pacing the comparator for all the studies you found?
Yes, that was the basic idea, to have right ventricular pacing as the comparator for all of the studies. But I found an article which is comparing directly the two newer one methods, and so we might have one.
Yes, still have both directly and
indirectly, and indirectly, if it will be possible, according to the statistical team advice, if it will be possible, we would like to do the network meta-analysis.
Great. Thank you very much, and congratulations.
Thank you.
Thank you for your presentation. Very nice indeed. Regarding your second project, one of the outcomes is incidence. Incidence upon what follow-up time?
Yes, that is a very challenging subject. We are dealing with that right now. It will obviously depend on the articles we can identify, but basically the patients are followed up after this flutter ablation ranging from like 6 months to 12 months. So I think those will be the time slots for checking the incidence.
Practically, the follow-up time might correspond to the follow-up time for recurrence of the initial affection?
During the follow-up, we wish to have data about the appearance of the recurrence, and that would be the ideal case, but I don't know the exact answer to this question. I will answer that after we do the feasibility check and have all of our key articles identified.
Thank you.
Thank you.